Hi, my name is Elizabeth Moore, and I'm a nursing student at Indiana State University, and this is my presentation on measles. Population at risk. People at high risk for severe illness and complications from measles include unvaccinated infants and children younger than 5 are at highest risk of measles and its complications, including death, adults over the age of 20, unvaccinated pregnant women, people with compromised immune systems, and any non-immune person who has not been vaccinated or who was vaccinated but did not develop immunity can become infected. Measles is still common in many developing countries, particularly in parts of Africa and Asia. More than 95% of measles deaths occur in countries with low per capita incomes and weak health infrastructures. Measles outbreaks can be particularly deadly in countries experiencing or recovering from a natural disaster or conflict. Damage to health infrastructure and health services interrupts routine immunization, and overcrowding in residential camps greatly increases the risk of infections. Objectives. By the end of this presentation, you should be able to summarize the signs and symptoms of measles, identify common risk factors associated with measles, list the complications of measles, identify prevention techniques, and discuss treatment options. Please pause now and take the attached pretest. What is measles? Measles is a childhood infection caused by a virus. Once quite common, measles can now almost always be prevented with a vaccine. Also called rubeola, measles can be serious or even fatal for small children. While death rates have been falling worldwide as more children receive the measles vaccine, the disease still kills more than 100,000 people a year, most under the age of 5. As a result of the high vaccination rates in general, measles hasn't been widespread in the United States for more than a decade. Most of the cases originated outside of the country and occurred in people who were unvaccinated or who didn't know whether or not they had been vaccinated. Transmission. Measles is one of the world's most contagious diseases. It is spread by coughing and sneezing, close personal contact, or direct contact with infected nasal or throat secretions. Measles is so contagious that if one person has it, up to 90% of the people close to that person who are not immune will also become infected. The virus remains active and contagious in the air or on infected surfaces for up to 2 hours. It can be transmitted by an infected person 4 days prior to the onset of the rash to 4 days after the rash erupts. Measles outbreaks can result in epidemics that cause many deaths, especially among young, malnourished children. In countries where measles has been largely eliminated, cases imported from other countries remain an important source of infection. Risk factors for measles include being unvaccinated. If you haven't received the vaccine for measles, you're much more likely to develop the disease. Traveling internationally. If you travel to developing countries where measles is more common, you're at higher risk of catching the disease. Having a vitamin A deficiency. If you don't have enough vitamin A in your diet, you're more likely to have more severe symptoms and complications. Measles signs and symptoms appear around 10 to 14 days after exposure to the virus. Signs and symptoms of measles typically include fever, dry cough, runny nose, sore throat, inflamed eyes or conjunctivitis, tiny white spots with bluish white centers on a red background found inside the mouth or on the inner lining of the cheek, also called Koplik spots. A rash made up of large, flat blotches that often flow into one another. Complications of measles may include ear infection. One of the most common complications of measles is a bacterial ear infection. Bronchitis, laryngitis, or croup. Measles may lead to inflammation of your voice box or inflammation of the inner walls that line the main air passages of your lungs. Pneumonia. Pneumonia is a common complication of measles. People with compromised immune systems can develop an especially dangerous variety of pneumonia that is sometimes fatal. Encephalitis. About 1 in 1,000 people with measles develops a complication called encephalitis. Encephalitis may occur right after measles, or it might not occur until months later. Pregnancy problems. If you're pregnant, you need to take special care to avoid measles because the disease can cause preterm labor, low birth weight, and maternal death. Nearly 1 to 3 of every 1,000 children who become infected with measles will die from respiratory and neurologic complications. Subacute sclerosing panencephalitis, SSPE, is a very rare but fatal disease of the central nervous system that results from a measles virus infection acquired earlier in life. SSPE generally develops 7 to 10 years after a person has measles, even though the person seems to have fully recovered from the illness. Diagnosis. Your doctor can usually diagnose measles based on the disease's characteristic rash as well as the spots on the inside lining of the cheek. However, many doctors have never seen measles, and the rash can be confused with a number of other illnesses. If necessary, a blood test can confirm whether the rash is truly measles. The measles virus can also be confirmed with a test that uses a throat swab or a urine sample. A nasal aspirate test can also be done. Your healthcare provider will inject a saline solution into your nose and then remove the sample with gentle suction. A spinal tap can be done if meningitis or encephalitis is suspected. For a spinal tap, your healthcare provider will insert a thin hollow needle into your spine and withdraw a small amount of fluid for the testing. Treatment. There's no specific treatment for an established measles infection. However, some measures can be taken to protect vulnerable individuals who have been exposed to the virus. Post-exposure vaccination. People who have not been vaccinated, including infants, may be given the measles vaccination within 72 hours of exposure to the measles virus to provide protection against the disease. If measles still develops, the illness usually has milder symptoms and lasts for a shorter amount of time. Immune serum globulin. Pregnant women, infants, and people with weakened immune systems who are exposed to the virus may receive an injection of proteins or antibodies. When given within 6 days of exposure to the virus, these antibodies can prevent measles or make symptoms less severe. Medications, including fever reducers, over-the-counter medications such as acetaminophen, ibuprofen, or naproxen, are used to help relieve the fever that accompanies measles. Antibiotics. If a bacterial infection such as pneumonia or an ear infection develops while infected with measles, the doctor may prescribe an antibiotic. Vitamin A. Children with low levels of vitamin A are more likely to have a more severe case of measles. Giving vitamin A may lessen the severity of the measles infection. Prevention. The Centers for Disease Control and Prevention recommends that children and adults receive the measles vaccine to prevent measles. Measles vaccine in children. To prevent measles in children, doctors usually give infants the first dose of the vaccine between 12 and 15 months, with the second dose typically given between the ages of 4 and 6 years old. Measles vaccine in adults. You may need the measles vaccine if you're an adult who has an increased risk of measles, such as attending college, traveling internationally, or working in a hospital environment, or if you were born in 1957 or later and you don't have proof of immunity. If you're not sure if you need the measles vaccine, talk to your doctor. Preventing measles during an outbreak or known infection. If someone in your household has measles, take these precautions to protect vulnerable family and friends. Isolation. Because measles is highly contagious from about 4 days before to 4 days after the rash breaks out, people with measles shouldn't return to activities in which they interact with other people during this period. It may also be necessary to keep non-vaccinated people, such as siblings, away from the infected person. Vaccinate. Be sure that anyone who's at risk of getting the measles who hasn't been fully vaccinated receives the measles vaccine as soon as possible. References. Thank you, and please see the attached post-test and brochure that accompanies this video.